This will be live stream on the YouTube. I'm just setting up that right now. This will be live.
It's nice to see everyone here. It's a beautiful Sunday morning here in Oklahoma.
So we're excited and we're just waiting for a few more. I think we should start in a minute, Meenakshi.
Yeah, I think you can start, Gauri.
Okay. So we're going to start our webinar today, Integrative Care to Autism, Integrative Approach to Autism Care. Again, a big welcome to all our panelists over here. We are very excited to have all our esteemed panelists, and we also are very excited for all those people who are joining us from all over the world here today. So today's session, we're going to start with the prayer, and I will request Dr. Deepa Bhatt to start with the prayer.
Namaste everyone, welcome. Please join me when I do this prayer for Lord Dhanvantri, invoking the blessings. Namami Dhanvantarim Adidevam Surasurairvandita Padapadmam Loke Jararik Bhayamrityunasham Dhataramisham Vividaushadina. Thank you.
Thank you so much, Deepa. It was just wonderful to start our webinar with invoking Lord Dhanvantari. And after this, I will request Dr. Meenakshi Gupta to talk a little more about AAP, its mission, its vision, and introduce our board members as well.
Thank you, Gauri. Good morning, everyone. I'm delighted to introduce the American Association of Ayurveda Professionals, an organization dedicated to nurturing authentic Ayurveda practice across the globe. Our mission is clear: to unite, educate, empower BMS, MD Ayurveda, PhD Ayurveda professionals to advance genuine Ayurveda practices, teaching, research, and leadership. We are also committed to strengthening community health, fostering global integration, and upholding the true spirit of Ayurveda. Embedded in this mission is our vision to see Ayurveda embraced as an essential, well-integrated system with broader healthcare, where Ayurvedic expertise is respected, communities are supported, and professionals thrive with integrity and support. Why AAP stands out? AAP board is composed of professionals from vast array of backgrounds, including Ayurvedic physicians, naturopaths, dietitians, acupuncturists, lawyers, scientists, and many more. This diversity reflects our inclusive philosophy of Vasudev Kutumbakam, the word as one family, and our dedication to Satya and Ayurveda, ensuring transparent education so that consumers understand different levels of Ayurveda expertise. Our board of directors, respectfully, Dr. Amit Ghumman, who is a president, founder and chief clinician at Harmony Healing Center, Oklahoma City, integrating Ayurveda, naturopath, yoga, acupuncture, and more since 1994. Vaidya Deepa Bhatt, secretary and treasury, founder of Institute Promoting Vedic Sciences, Classical Arts, BMS MD trained with Masters in Panchkarma, experienced yoga teacher and active leader in both tapas and AAP governance. Dr. Shan, board member, PhD in Applied Physics, Harvard trained Vice Chancellor at Vetha Center, research advisor at Wise Harvard, editor of multiple peer-reviewed journals, and distinguished voice bridging science and consciousness. And myself, Vaidya Meenakshi Gupta, a classically trained Ayurvedic Vaidya and Panchkarma specialist, gold medalist in Ayurveda, and educator over 2 decades with international experience in Ayurveda and nutrition. And lastly, our board of director, Vaidya Gauri Junarkar, registered dietitian and diabetes educator who integrates Ayurveda with modern nutrition throughout her practices, Ayur Nutrition. She is also an author, podcaster, and advocate for integrative wellness. Over to you, Dr. Gauri Junarkar.
Thank you so much. Thank you so much, Meenakshi. And again, a big welcome to all our esteemed panelists as well as all our participants who are joining us from all over the world. We're going to start our session with giving a brief introduction of our esteemed panelists. Let's start with Professor Sanjeev Karla. Dr. Sanjeev Karla, he's deeply committed to transforming the healthcare industry. He has comprehensive understanding of the complexities and challenges within the sector. He has leverage for visionary leadership to develop innovative strategies and drive meaningful change. His extensive experience allows him to navigate the ever-evolving landscape of healthcare, effectively influencing policies, implementing cutting-edge technologies, and improving patient outcomes. He is passionate about delivering high-quality care and dedicating to shape the future where accessible, equitable, and efficient healthcare is a reality for all. Currently, he's a director of clinical training and integrative mental health specialist for Maharshi International University, Fairfield, Iowa. He's board certified in India at Niramaya, the Mind Center specializing in special able children and psychiatry. Welcome, Professor Dr. Sanjeev Karla. The next esteemed panelist is Dr. Vaidya Vinayak Taide. Dr. Vinayak Tade, he got his MD, BMS MD in Ayurveda, and he's also a PhD in Ayurveda. He's a retired professor and head of medicine at Srimati KGMP Ayurveda Mahavidyalaya in Mumbai, and the founder of Mahanagar Ayurveda Seva an Ayurveda expert recognized by the government of India. He has served internationally at Karnataka University, USA, and as an honorary physician to the governor of Maharashtra at Raj Bhavan, Mumbai. He's an Ayurvedic physician, has served as a member of the Central Council of Indian Medicine under the Ministry of Ayush and contributing to its Constitution Planning Education Committee with over 18 years of undergraduate and 10 years of postgraduate teaching experience. He has guided students, served as examiner for leading universities, chaired multiple postgraduate committees, and contributed to curriculum development. He has presented at numerous national and international seminars. He's also an author and also given various webinars, seminars, workshop as well. His work has been recognized with multiple awards, including the Lifetime Achievement Award, Dhanvantri Puraskar, and several national and international honors. He's deeply committed to a social service. He has organized free medical camps across India for decades, making a lasting impact on both Ayurveda and community health. So welcome Dr. Vinayak Tade as well. Our next esteemed guest is Dr. Sailaja Gulla. So Dr. Sailaja Gulla is a board certified neurologist and a neurodevelopmentalist with national and international expertise in autism and related neurodevelopment conditions. She currently practices at the Thompson Autism and Neurodevelopment Center at CHOC, where she serves as the director of the Fragile X Clinic, research and fellowship director for the Neurodevelopment Disabilities Program, and the associate professor at the UC Irvine School of Medicine. A dedicated advocate for children with Fragile X syndrome, autism, and neurodevelopment disabilities, she leads multiple research studies and has presented widely at national and international conferences, trained at premier institutions in India and the US, including UT Southwestern Medical Center, where she had become the first graduate of its neurodevelopment disability program. Dr. Gola has received numerous honors such as a Teva Neuroscience Award, the Leon Besberg Award, the D Magazine Best Doctors, and America's Best Physicians. Welcome, Dr. Sailaja Gulla. The next esteemed panelist is Amruta Poddar. So Amruta is a pediatric speech language pathologist with 20 plus years of experience providing speech, language, and feeding therapy for children of all ages. Her therapy approach combines the elements of mindfulness and Montessori, allowing her to enter into each child's world and support them as they explore, play, and build connections with those around them. She strives to empower parents and caregivers to be in the driver's seat of their child's therapy journey through the parent coaching. Every session is personalized, culturally responsive, and takes a strengths based approach while focusing on fun and functional activities. She's also conducted educational seminars for parents, enrichment, and group classes for children in her local community. Welcome, Amrita. Our next esteemed panelist is Sridevi Jagdishan. Sridevi Jagdishan is a registered dietitian. IFNC is a licensed dietitian, integrative, and functional nutrition certified practitioner in Dallas. Inspired by her own healing journey from chronic steroid side effects, she has now helps clients from children to adults addresses the root causes through functional nutrition. As a registered dietitian in Dallas, she extends holistic services from pediatrics to adults, addressing the root cause through functional nutrition. Her background in biochemistry and functional nutrition has deeper understanding of the body's healing mechanisms and epigenetic approach to nutritional healing. Passionate about her mission, she encourages others to embrace the philosophy, let food and lifestyle be your medicine. Welcome, Sridevi Dakrisan, again to our session. So again, a big welcome to all our panelists again. So we're going to start with a few questions. Again, just want to go over the disclaimer and some house rules. Disclaimer is again for everybody. This is an educational webinar seminar, and education imparted in this session is for education only. It does not provide medical advice. Make sure to talk to your healthcare professional before making changes to the healthcare plan. Some ground rules. If you have any questions, please keep them in the either in the chat or please send it to us, and we will be answering those questions towards the end of our entire session. Also, a request to all the panelists to keep the answers brief. We have a whole lot of different questions that we actually going to go through as well. Okay? So we're going to start with a question. And this is to all the panelists. From your professional perspective, what are the most critical needs in caring for children with autism today? We'll start with Professor Dr. Sanjeev Karla.
Thank you, everyone over here, and I welcome all here in this session today. So when we talk about children's needs and wants, basically suffering with the autism specifically, these days it's very necessary to understand because kids are never able to, express their concerns. And autism means they may be into the milder state, moderate or severe conditions. And, their needs and wants, we need to understand being parent sometimes that exactly what's happening with them. And since they are not expressive sometimes, communicable conditions, communicable, you know, communication, lack of communication may be there with some kids. Yeah, behavior is there. So we need to understand they need utmost care because at the age of, if we try to diagnose at the age of, as early as possible, early intervention program, we call it as EIP. If we start at the earliest stage, means even nowadays, kids at the age of 1.5 or 2 can be diagnosed with. We have such technologies now with such, parameters, such scales. We have diagnostic scales where we can actually track their progress, development. And after then, can take care of their wants and needs. Basically, I would say that as early as possible, whenever we, could help the parents first, because they must know, because it starts right with the prenatal, in the during the pregnancy itself, when parents are, needed to be, be made aware of the circumstances they are going through, or probably they must go for a few of the tests which are very much necessary these days for viruses or any bacteria or any kind of things. So these all things are actually Ayurveda sees this very in very detail. Punsavan karma are there, several other karmas are there which were already before planning of the babies. So there were all rules and regulations what in Ayurveda we always have followed, but nowadays with the most advanced techniques and technologies, we are going forward with AI and ML nowadays. So it's very much, it's becoming more interesting to see all those advancements for diagnosis, and then going for the prognosis and treatment. As soon as we diagnose, prognosis becomes more and more better, and the treatment is also better done.
Thank you, Dr. Karla. Next, I would say Dr. Taide, you could also share your insights for this question as well. Dr. Taide, you're on mute.
Thank you, Dr. Gauri. Today's questions is critical needs in autism. First thing, Prakriti assessment is necessary for autism. Second, dosha balance is also necessary for autism. Third is the Agni assessment. Agni assessment is necessary for autism. And fourth is the environmental factor. Evaluation is most important for autism. And third is the Dinacharya and Rutacharya. Adjustment is also necessary for autism. Fourth is the speech language pathologist is also necessary for autism, and occupational therapy is also necessary for autism.
Thank you so much, Dr. Taide. I would also ask Dr. Shailaja Bulla to share her insights on this question as well.
Yes, thank you, Gauri, for having me on this panel, and it's wonderful to join the other panelists. I think the key points for critical needs in caring for children with autism today is early identification and intervention, like Dr. Sanjeev and others mentioned. That's the most important thing. Timely diagnosis is essential because time lost is time gone. With the advent of AI and newer diagnostic techniques, now we can upload some apps on the phone, and community physicians and other therapists can assist in the diagnosis of autism while they're waiting to see specialists such as psychologists. Parent-mediated intervention is another critical need. Parents need to be trained because that empowers the caregivers to support communication and social engagement from infancy. Emphasis on optimizing the environments and incorporating a neurodiverse environment, like being inclusive and accepting autism and making them feel as part of one family rather than a separate diagnosis or a disease. That's very important. Access to care. There is a crisis to autism services due to the rising prevalence. Right now, it's 1 in 36 diagnosed with autism, and there is limited specialist availability. Programs like Echo Autism, where you're trying to train the community pediatricians throughout the globe. That's been a very important inclusive healthcare model to access coordinated care. Collaborative care models between pediatricians, Ayurvedic specialists such as you all, mental health professionals, educators is very important to provide comprehensive support. So hoping to work together as a collaborative model. Family-centered support, not just the diagnosis, but also parents go through emotional, relational, logistical stresses. So rates of depression are high among caregivers. So addressing that would be important, like providing family therapy, mental health and behavioral support, such as applied behavior analysis and other therapies are very important. And equity and inclusion, again, not to forget, is very important. These are the critical needs I would like to suggest.
Thank you so much, Dr. Gola. And next is Amrita. If you could also share your light on the critical needs as well.
Thank you. Thank you for the opportunity. I will say, all these esteemed professionals have already, I agree with everything that was discussed. There are so many avenues available these days. So much education is available. So much information is available. And literally information is at our fingertips these days. And so early identification, early intervention is possible. But unfortunately, we still hear, oh, your child will grow out of it, or, because of COVID, da 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 da. And I think that's a critical need. Like in the past 5 years, a shift somehow has happened where pretty much, we are blaming COVID for a lot of things and hoping that our, children have pseudo autism, or have, too much TV exposure, too many video games exposure or whatever, screen exposure. And that's why, reduce that and they'll grow out of it. So education, I think that just lack of education and awareness still seems to be, in spite of autism being around for so many years, still seems to be a very critical need. And then guidance and support for parents, because sometimes, unfortunately, in our community, we are not able to find that support or acceptance within our immediate environment. And so having that larger family, if I may, where parents are able to find that support in with other parents or through forums like this, where they are able to see, oh, I'm not the only one. There are other people around me who are kind of going through the same thing. And as far as speech pathology, speech therapy goes, like access to communication, it may not be verbal communication or mouth words as we are now saying it, but some form of communication, and accepting that as the beginning, and having that good coordination of care amongst all the professionals right from the beginning.
Wonderful, Amrita. And then I would request Sridevi to again shed her light on the critical needs for autism kids today.
Thank you, Dr. Gauri. So apart from the other, whatever the other the esteemed panelists has shared, I would like to point out one recognition of this autism community, right? So they have to be recognized as neurodivergent and not as someone with neurodevelopmental issues, especially when they're high functional. I've seen many of the autistic kids, like they have a special quality, or at least I would say the special talent they have. It's important to recognize it and hone in on that perspective. So I feel that education and awareness has to be given to the parents to recognize them as neurodivergent and keep working with them, because there's definitely a big light, that's like brighter light that's shining at the end of the tunnel, which they have to recognize. Otherwise, I see parents get doomed with this diagnosis. Thank you.
Wonderful, wonderful, Sridevi. Thank you so much. I mean, this is really a great start to our session today. My next question is to Professor Dr. Karla. How is autism conceptualized in Ayurveda?
So Ayurveda again sees this as it has never been discussed in Ayurveda specifically for autism. But yes, we for the last 5 to 6,000 of years, we have been, reading much about and diagnosing and treating about Unmada in Ayurveda, which is most closely, it resembles closely with autism in pediatrics. We call it as specifically for pediatric population we are discussing here, but this autism can be found even in adults nowadays, because as the awareness grows, it can, we can diagnose with ADHD, autism, any of those kind of conditions, along with the anxiety, depression, or bipolar conditions. They are actually ADHD is most probably with the boys, and mostly comorbid with autism. But in Ayurveda, when we see that it is the critical or complex imbalance of doshas, specifically Vata, then Pitta and Kapha. So how it is very much conceptualized in Ayurveda, because Ayurveda sees it as the imbalance of not only doshas, we also see the Shrota Avrodha at the level of Manovashtotas and Sangyavashtotas, right? Manovashtotas, when we see, they are channels through which impulses, chemicals, or electronic impulses go through, and that is the communication kind of thing. And then comes the Sangyava Shrotas, consciousness, when we call it as, right? So these are all, then at the level of Agni, when we talk, it is a big concept. But if I just short this thing to, make it short to, few of the subdosha types, pranavata, specifically pranavata, udanavata, vyana, sadhak pitta, pachak pitta, tarpak kapha, they all are actually very much closely related to, give all those symptoms what we see in the form of autism nowadays. Because autism is not something that we just limit them those symptoms and signs into 3 or 4 things, like repetitive behaviors, or lack of communication, right? Whether verbal or non-verbal, or sometimes we call it as isolation of the kids, or some other behaviors they show, tantrums they show, or with anxieties sometimes, or hyperactivities. So these are not limited to. So in Ayurveda specifically, if I will go definitely for subdoshas, which play a very critical role along with Manova and Sangyava Shrutasya.
Thank you so much, Professor Karla. You've explained it so beautifully. My next question is to Dr. Vinayak Tade. What Ayurvedic therapeutic approaches can help support autism care? Dr. Tade.
First thing, Ayurvedic management, especially for autism, autism can be correlated with the Vat Kafaja Unmada, especially Vat Kafaja Unmada Panchakarma treatment is especially for autism, because in Ayurveda, autism is not mentioned in our Charak Samhitas, but we can do the all treatment of autism according to this statement. Vikara nama kushalaha न जीवति कदाचनाः न हि सर्व विकाराणाम नामोतो ध्रुवास्थिते. It means autism is not mentioned in science in Ayurveda Samhita, but we can do the diagnostic according to sthana, lakshana, dosha dusha, akruti, so that according to this statement we can do treatment and correlate with the autism with Vata Kafaja Unmadaha. Vata Kafaja Unmadaha, sign and symptoms of Vata Kafaja Unmadaha is correlated with the neurodevelopment disorders. It means the social communication, repetitive behavior, etiological, biological patterns, and repeated disorders and mental disorders. Buddhi Viprama, Vidhi Vibram disorders affect Majja Dhatu. Mental disorders can correlate with the Manova Srotas and holistic approach, spiritual assessment. Another, the therapeutic approach in Ayurveda, the Medhya Rasayana, Panchakarma treatment, Shiro Dhara, Shiro Basti, Shiro Pichu, Nasya, and Shodhan treatment, specifically purgation and emesis, and it means Vamana, Virechana, Abhyanga, and Svedana. These are the treatment specially for autism is correlated with the Vatajivanmade. Thank you.
Thank you so much, Dr. Tade. It was absolutely an amazing answer. Our next question is to Dr. Sanita Golda. From a pediatric neurology standpoint, what recent advancements have shown promise in supporting children with autism? Dr. Golda.
Thank you, Gauri, for the question. And there are a lot of new advances in the field of pediatric neurology and genetics specifically. In terms of genetic testing, we all know that there is a 20 to 30% chance that there is a genetic cause for autism. Currently, as per the American Academy of Pediatrics and the American Academy of Neurology and Genetics, the chromosomal microarray, Fragile X testing, and the whole exome sequencing is also approved. And families don't have to worry about insurance. It's covered by insurance, most of these studies, because we don't want to miss out on a genetic cause for autism, such as Fragile X syndrome, which can cause autism. There is also newer functional MRIs and EEGs to detect subclinical seizures. There's quite some advances in there as well. In terms of neuromodulation and feedback, there is transcranial magnetic stimulation, which shows the potential for improving social cognition, empathy, and speech as well. Neurofeedback devices are explored as well. There is also some therapies which are still in research, like the cannabinoid-based therapies, which definitely we need to confirm safety and efficacy, but there's still research going on there. Also, there is a role in precision medicine, which deals with neuroimaging in combination with genetics and AI-powered tools to help in the diagnosis. And I think these are all some of the new developments. But in terms of treatment, there's also some studies going on with gene therapies, and that's again another important role to test all these children for genetics, because that'll probably be a newer treatment going forward, because autism is highly genetic, though there are multiple mutations involved. There are single gene disorders as well, and there's a potential for gene therapy in the future. So these are some of the new developments in the field of pediatric neurology, specifically for autism. Thank you.
Thank you so much, Dr. Shailajabula, for providing your insights and sharing the exciting advancement about the recent advancements supporting children with autism. My next question is to Sridevi. What role does diet play in managing autism, and how do you address dietary restrictions, sensitivities, or selective eating?
Thank you,
Sridevi.
Dr. Gauri. So, diet definitely plays a significant role in autism, especially when we are here to balance the inflammation. So, normally, because we know they're present with a gut dysbiosis, where addressing the food allergies or sensitivity takes the prime importance, right? Like Dr. Sanjeev pointed out, the digestive fire. That's something that hones in well with dysfunctional nutrition and the Ayurveda. And of course, when Vata goes high, because the digestive fire is not enough, they don't digest the food well and they accumulate toxins, right? So it's like, so I kind of call this as a clogged sink effect, to put it in the layman terms, where the sink is clogged and the tap is also open, and there's going to be the overflow of the water, right? So the first step for this would be to close the tap. That means I'll be removing the allergic or sensitive foods. And then I have to empty the sink. That means I also have to add a lot of nutrients that when I remove the sensitive or the allergic foods, what are the nutrition deficiencies this would eventually develop into. I have to take care of that also. See, for example, let's say the kid needs to be away from eggs, for instance, then the nutrient choline and protein becomes a the critical here, right? So then they definitely play a role in acetylcholine as neurotransmitter, and can also be a good assist when their methylation cycle is clogged, because methylation and detoxification is closely combined, and that kind of leads to over toxin accumulation and high vata. And of course, it's a vicious cycle with the digestive fire being disturbed by that, right? So here then I can give some alternatives for colon, the non-egg alternatives, but at the same time, they also need some supplementation for colon here. But when we do colon supplementation, we have to be very careful about the order of when we supplement this, because the gut health really hones into the colon supplementation, because colon can react to the gut bacteria. Right. So it's like depending on the gut health, the colon also should be supplemented. So what we first do here is to initially work on adding more vegetables, fiber, and magnesium in the diet and get the gut a little bit better. Then we also do the elimination simultaneously, and then we kind of give the colon supplementation so it becomes effective. This is just one example. So there's like so many things that we can talk, but since for the lack of time, I just pointed out some examples. And also, like when it comes to the food sensitivities, right? So really, the picky eating becomes a big challenge, right? So it's like when we have to remove some sensitive foods, then picky eating is like when that is all they are going to eat, then the parents are really, not buying into it, because that's the only thing my kid is eating, right? So it's like, But really, awareness has to be given to them here, because sometimes the picky eating even develops because there could be some stomach discomfort that has been happening. And since the kids are not able to express their stomach discomfort with autism, that they are kind of negatively reinforcing in naturally avoiding that food. So it would be helpful to just give them that information and just teach them about why it is important to be away from this, and then give some break to the gut so we allow some time to unclog and empty the sink. And also, like, I feel here some coordination of care also is very important with the speech therapist and with the feeding therapist, because they really help us to fade in the replacement of the food that we are supposed to, and they help us to fade out the sensitive foods out of their diet. Yes.
Thank you so much, Sridevi, for providing wonderful insight. Especially you touched based on the gut health, and that's one of the things we're going to actually talk about next. So the next question is to Amrita. What strategies in speech therapy help improve feeding and communication skills in children with autism? Amrita.
Thank you for that question. And the Sridevi's answer really kind of feeds into, really goes well with my answer here. I mean, yes, that multidisciplinary approach, that's key, really, because there is a lot of, we want to support the microbiome, we want to support gut health, but then because of previous experiences with food, the child may have developed some anxieties. There could be some sensory-based restrictive diets, or there could be anxiety-based restrictions, selective eating. There could be so much going on. So really kind of teasing through that and coaching the parent to, not take it personally. It's not their fault. That is, we are here to support our child to get adequate nutrition. And also making sure that, we're really doing a skills assessment. Yes, we're looking at the nutrition and the GI health and all of that, but also looking at the child's skills. We do know from working with children, and there's so much evidence coming out now that our children with autism do have some motor-based deficits. A lot of children do. So really doing like a comprehensive skills assessment. Is there a motor planning deficit? Is there a sensory-based deficit in the oral structures? Is it something going on in their motor planning otherwise, which is keeping them from sitting comfortably at the table? So there could be a lot going on there too. So using those, the skills-based feeding approaches, gradually exposing foods, reinforcing, eating habits, avoiding like the coercion, like one more bite, or else, like staying away from those strategies. And also, someone touched upon lack of communication being a factor. Yes, our children are not able to indicate if it's a stomach pain or just discomfort. They may not have the vocabulary, excuse me, but also they may not know that what they're feeling is discomfort versus pain. Our children with autism don't always have that. They do have the perceptual differences. What might be pain for me might not be pain for them, or what might be a simple discomfort for me may be severe pain for an autistic child. So we do know that there are these perceptual differences. So being cognizant and being mindful of those, and giving them the visual supports that they might need, first this, first that, giving them an option of serving themselves at the table, that the parent can provide, the parent gets to decide what is provided at the table or what goes in the plate, but giving the child the ability to choose how much they're going to eat and whether they're going to eat. So, using those kind of practical strategies help.
Amazing, Amrita. Thank you so much. I mean, it is so wonderful that, as we are proceeding in this webinar, is everybody's pointing out their perspective. And my next question actually is tying up with the gut health. And this question is for all of the panelists over here. What is a connection between gut health and autism, and how do dietary, Ayurvedic, neurology, and speech interventions support this relationship? Who would like to go first?
I could go first as a piggyback to what I said just now. Again, as an SLP, a speech therapist and a feeding specialist role, just educating the parents and being on the team to reduce mealtime stress, supporting the GI doctor and the dietitian's recommendations by optimizing safety during swallowing. Again, if there's a skills-based, if they're not able to safely chew and swallow, addressing that and progressing through their diet, creating a sensory friendly routine and structure. Maybe this child just needs some kind of seating or accommodation so they're able to sit for 10 minutes maybe in one space so they can focus on their eating. And these kind of approaches, but also as a feeding specialist, being mindful of how their gut is behaving and what is being targeted for their microbiome to flourish, and then providing these strategies.
Okay, who would like to go next?
I can go. So, from a neurology perspective, I think we always talk about the gut-brain axis, and it's very important that there is a connection and there is key mechanisms involved as well between the gastrointestinal tract and the central nervous system. So, in children with autism, this tract is disrupted, potentially influencing behavior, cognition, and emotional regulation, and hence we need the help of our occupational therapists and nutritionists and dietitians as well. And there are a lot of studies done which show that there are increased levels of the bacteria like Clostridium and so on, which can cause this dysbiosis or imbalances between the behavior and the CNS symptoms. The common symptoms we see are like constipation, diarrhea, abdominal pain, reflux, which can all affect a child with autism. In terms of new treatments, which involve the gut biome axis, I think there is a lot of research done with microbiota transfer therapy, which involves like transferring like the healthy gut bacteria to children with the ASD, and it has shown some improvements. Probiotics and prebiotics have shown some improvement with reducing the inflammation and also supporting neurotransmitter imbalance, dietary interventions. And there is new research based on the 2023 meta-analysis, which shows that there is a very strong association with gut microbiomes, immune profiles, and how the genes are expressed. And diet regulation is very important in a child with ASD. And these are all modifiable factors. So hoping that would help. Thank you.
And Dr. Carla had raised his hand. Dr. Carla?
Yes, I would like to mention here that as we talk about healthy gut and brain axis, right, means central nervous system working with enteric nervous system, right? So we have several neurotransmitters which actually play a very, very important role in the gut as well, like dopamine, right? Very important. But at the same time, we have other neurotransmitters. And when we talk about from the perspective of Ayurveda, we have specially now we discuss about the importance of Vata and Pitta and Kapha, right? Doshas, imbalance. So that imbalance actually leads to the improper, first one is the timings, as mentioned by Dr. Amrita, and other things like timings, and parents actually are to be educated for that, means when and where they need to take care of. And we plan accordingly the diet charts, we plan accordingly as per the dosha prakriti and vikriti at the time of imbalance as well, right? So we advise always the diet plan with the help of nowadays maybe the imbalance whatever we find in vata or kapha or pitta, as we discussed about. Accordingly, then we decide about, as Dr. Gola was telling about, that's very important to understand the role of that prebiotics and probiotics. When we talk about prebiotics and probiotics, the absorption of nutrients should also be there. That plays Agni plays a major role in that. We need to understand the Agni's role as well, the digestion and metabolism here. So we need to, plan a diet which is actually light, at the same time very nutritious, with the anxiousness and all other nutritional things we need for kids, specifically in smaller, at the smaller gaps and small diet levels, by avoiding anti-inflammatory diet like sugar things, chocolates, or chips these days. Chips are there, several other things are there which actually cause ama in our bodies. Children don't know what they are eating, but parents do know what they are feeding actually. And not for the sake of that a child is crying or something, they show tantrums or stubbornness, but that is not their problem. That the problem lies somewhere else. So we need to plan accordingly as per the prakriti and vikriti of both the imbalance and imbalances, right? So like that, we understand that the role of other omega fatty acids, we use that, some nootropics we use, but everything depends upon the diet. How we plan diet is very important. That plays a major role in maintaining the gut and brain axis.
Thank you so much, Dr. Karla. Dr. Taide?
Yeah. Digestive fire is connected to gut health. If Agni Vikruti, it means the Agni man the stage, arm is produced. In this condition, for toxin elimination, Panchakarma therapy is most important. That is the Basti Virechana. And novel formulation is also important for Agni, increasing Agni, that is the Deepana Pachana Anulomanam Chikitsa. It means increasing Agni and arm elimination. For increasing Agni, Chitraka, cumin, and ginger. For the increasing Agni, Parpati Kalpana is necessary for Agni and arm elimination. Thank you.
Thank you, Dr. Taide. Sridevi, because this is an important thing with the gut
Yes.
health, definitely need
Yes,
your perspective.
absolutely. Yes, I'm so excited to talk about the gut always. So it's like, because this is where something we can definitely make a big difference as dietitians. So here I would like to, because a lot of things has been pointed out already. Some of the things that I wanted to point out here that has not been covered is something related to the gut brain axis and the behavior of the kid, right? So we've seen like sometimes when the Clostridia bacterium is really high, the kid's behavior gets aggressive. And so this Clostridium kind of produces the metabolites that can interfere with the neurotransmitter production, right? So it's like, and so from the dietary approach for that would be, because when the Clostridium levels can go high when there's too much of glyphosate in the system, which comes from the pesticide toxins. And so like it's encouraging them to take a lot of organic foods, and non-GMO foods is really helpful. So this helps to, and also help adding some nutrients to get rid of this glyphosate from the system. But it just takes a long time to get rid of this glyphosate from the system. But still, it's good not to add more. So it's always better to do organic food. So that's one thing. And another thing would be the candida dysbiosis, right? So whenever candida levels goes high, they also interfere with the B6 utilization, and we know B6 vitamin is very important to make all neurotransmitters, whether it's serotonin, GABA, or melatonin, or anything for that matter, dopamine, for example, like Dr. Sanjeev pointed out, right? So it's like so it's very important to take care of this candida also, for which again, like we kind of have to see if there is any any food allergies and food sensitivities are going on. So there's so many things to it. So it's like this is a topic by itself that can take 3 days, but I just wanted to just keep it brief so I don't take too much of time otherwise.
Thank you so much, Sridevi. And my next question exactly is more specific as well. So, what therapeutic diets are commonly used in autism care? This is for Sridevi. Sridevi.
Yes, very popular diet would be the anti-inflammatory diet with gluten-free and dairy-free options. That's very popular. But in our practice, I encourage a hypoallergenic diet where I address the food allergy and food sensitivity, because there's no one size fit for all diet. If you do a gluten-free and dairy-free approach, it's more of a blanket approach. People do benefit from that, but that's not sometimes enough. We also combine it with some low to moderate oxalate diet based on their oxalate levels in the labs, because like I said before, when the candida levels are high, then they produce more oxalates in the system. So like then first we work on, we add some supplements to get rid of this oxalate, but at the same time we also have to make sure that we don't give oxalates, too much of oxalates from the food either. So we do a low to moderate oxalate foods too. And especially for vegetarians, I feel this is very critical, because this oxalate diet, when the oxalate level is so high, it can bind with the zinc. It can also bind with the other minerals like iron. And these two are very critical. Zinc and iron especially is very critical for the vegetarians, because for iron, we need vitamin C for absorption for vegetarian food. And also for zinc, I feel like we don't have much of zinc sources as much as the non-vegetarians do, right? With the vegetarian sources. So I feel like there is definitely no one size fit for all therapeutic diet method, but we have to really see what suit that person to even, so like I customize the diet based on what is best for them.
Thank you so much, Sridevi. I think that was a really important insight, the way you explained a lot about the low oxalate diet and everything as well. Now, my next question ties in with this as well. This is for Dr. Sanjeev Karla. How does Ayurveda address challenges like hyperactivity and digestion issues in autism?
So hyperactivity, as I mentioned, it is seen very less in female children, like female kids. But boys are more prone to have ADHD along with ASD. So hyperactivity means it's not something that we talk about vata. So that is what Vyan vata brings, that hyperactivity in kids. Vyana means circulation. Circulation means when it's not properly circulating throughout the body, right? And we have that kind of repetitive behaviors, coordination disturbances, and restlessness, that produces restlessness as well. So Vyana Mata, we talk about prana and Vyana both. Why? Because prana governs from here, from the brain, right? So this is very much necessary to balance both. At the same time, hyperactivity means when you means you play at rest. Play at rest means you create that kind of environment where stresses, external stimuli are less, you restrict the dietary, you come up with the dietary guidelines, you come up with some herbs and panchkarma treatments. Panchkarma treatments specifically, why I'm mentioning, because they are actually, you all scholars, everyone over here, they are all experts in their fields. And panchkarma is why it is always advocated for over 7 years of age, because then the kids, they have already developed, their brain age is already developed, their physical, they are able to balance their physical needs, means they are growing though, but they can withstand panchkarma procedures. With light panchkarma procedures, I'm saying, this is not full-fledged panchkarma procedure. That's how you start treating your kids, not just with the herbs or something, whatever the measures we take, but everything we need to come up with the there is a strong necessity of introducing ABA, applied behavior analysis, which is very important for those kids, right? Then comes up with occupational therapy, so that the kids get engaged with those therapies, and they therapists come to know that what are their skills, how they can be utilized in better ways. The kids' strengths and weaknesses, they could be worked on. So this is not something that we focus on one thing. There is no, we focus on one thing, that there is, lack of communication or repetitive behaviors. No, we focus on each and everything, but with specialized interventions from Ayurvedic perspective as well. right? So from herbs to diet to, panchkarma procedures to speech therapy to occupational therapy, ABA, everything is being introduced as a combined approach. We call it as integrative approach, what I actually am working on. And I have, within last 20 years, I have seen so beautiful results, except few cases where honestly, 3 cases of mine have, I, you know, I didn't, leave my hopes, but yes, uh, yes, I couldn't, completely help them. But yes, for the last 20 years, I have seen so much of improvement in, everywhere diagnosis and early intervention we were talking about, how we can help with more advanced technologies and more, advanced care. Even parents are nowadays very much, they are aware of the things. They are very educative, right? Not over here in the US, but I take patients in India as well. Their parents are very much aware of the consequences. And as Dr. Gula mentioned about genetic, gene therapy as well these days, which has been newly introduced for the last few years. But in India, and from Ayurvedic perspective, when we see that, we already have advocated those for thousands of years. How? Because we talk about, Punsavan karmas, or before those karmas, when we plan for a child, that how parents should be, they should be, educated well, guided. Their diet should be planned. Their parents' diet should be planned. The circumstances or environment they live, actually, that should be stress-free, because that is all what affects the genes when embryo forms. That affects everything. So first 9 months are very much necessary. So that's why Garbhini Paricharya means every month diet guidelines have been mentioned very thoroughly in Ayurveda. So this is important to see how Ayurveda sees it. This is very beautiful. Actually, this is a beautiful discussion where we all are, together to discuss, to come up with beautiful tailor-made, strategies. As Devi mentioned about, this is not one size doesn't fit all kind of strategy, but yes, we can tailor made, evidence made, decisions can be made, and these therapies can be, incorporated into the daily lives.
Thank you so much, Dr. Carla. My next question again is to Dr. Taide. What role does daily routine, dincharya, and seasonal routine, ritucharya, play in autism care?
Dinacharya, role of dinacharya is the doshic imbalance improvement. I try to avoid the holding natural urges. This is the most important for dinacharya. And rutucharya is a seasonal purification. In this condition, in this rutucharya, it means vasanta and vamana procedure is important. Varsha basti procedure is important, and Sharad Rutu is Virachan procedure is important. Rutucharya balance the doshik imbalance, and Dinacharya is also balance doshik imbalance. Thank you.
Thank you so much, Dr. Taide. And my next question is to Dr. Shailaja Gulla. Are there any new and emerging neurological therapies that show promise for children with autism?
Thank you, Gauri. I think we were just talking about genetics, maternal health, and gene therapies with Dr. Sanjeev. So I think with the emerging gene therapies, that's something new. And there is a website, and I can put it in the chat as well later on. It's clinicaltrials.gov, and I would like to share it with the whole audience. So if you just go to that website and put in autism, say gut-based therapies, gene therapies, genetics, new treatments, you get a whole list of studies all over the globe where parents can just call a number and try to participate if they do qualify for these emerging treatments. So I would like to kind of emphasize on that fact. In terms of just the emerging therapies and the pipeline treatments in brief. I think whole genome sequencing and whole exome sequencing is used to tailor treatments to child's unique genetic profile. Gene-targeted therapies are in the early stages, but they're aiming to address specific mutations like Fragile X syndrome, Rett syndrome, SHANK3 mutations, which are all causes of autism. And there are some predictive biomarkers like EEG, eye tracking are also helping to identify which children may best respond to certain interventions. In terms of neurobiological and pharmacological advances, there are some FDA-approved medications as well. And I always stress the fact, like medications are the last resort. If nothing helps, like ABA and other therapies don't help, these medications can help with social communication. Some examples are aripiprazole, which is now FDA approved for children with autism. There is also some experimental therapies with oxytocin-based or metformin, which is used for diabetes, which is still explored. And then the neuromodulation techniques like transcranial magnetic stimulation, which show some promising evidence with executive function, social cognition, and language processing. Neurofeedback therapies are also available. And as we all know, virtual reality now is being used to simulate social situations, like, for example, ordering food or classroom interactions, helping the child practice in a safe, controlled environment. So I would encourage virtual reality as well. AI-powered screening tools have improved early diagnosis, and there's several in research, but several have already been used in clinical practice. There's also social robotics, which are used to teach emotional recognition and communication skills, and also some interactive play. As we earlier discussed, microbiome and stem cell research, which is still in the pipeline, something which is exciting, which can connect the gut health and how it influences behavior. And of course, there are a lot of ABA-based models and newer parent-mediated models, behavioral strategies to help children, and some of them are naturalistic developmental behavior models, which is still in pipeline, but some of them are already approved. So these are some of the new emerging treatments in the field of autism, which show some promising results in early clinical phase trials. Thank you.
Thank you so much, Dr. Gola. I mean, this is amazing, how you explained them and talked more about these emerging new therapies as well. My next question is to Amrita. What are the most common communication challenges faced by children with autism, and how can therapy address them? Amrita.
Can you hear me? So the most common challenges in children with autism, we have the social communication, and now, of course, communication challenges or needs really depend on, I think, these days when the child is diagnosed with autism, usually the level is given, or how much, whether the child is a low support, low need, or high support, high need. So based on that, we see different communication profiles. So some children may have difficulties with joint attention or focusing. Some children may have difficulties with the social communication aspect. Some children may have, so much new evidence is coming out now that many of our children with autism develop language or speaking differently. What was traditionally thought of, the child first babbles and then speaks single words and then starts combining words and then speaks in sentences. There is so much evidence that is coming out that a lot of our children, with autism, what was seen as echolalia and something to get rid of, could actually be the first step in learning language, because our children with autism are learning language in chunks first. And echolalia actually is usually a form of communication, and it's not something to get rid of. It is something to investigate and kind of go deeper into, like, what is the function of this echolalia. If they are having those repetitive words and they're repeating nursery rhymes, But if it's in context, what is the function of that echolalia? And then how do we build language based on that? And then, most of our children, because they are learning language differently because of their neurodiversity, because of the differences in the way they're perceiving the world. They may not have access to the way their surrounding people in their environment are communicating. So having access to pointing, having access to communication boards, having access to AAC devices. There are so many apps now, some free, some paid, that are available on their, at their fingertips too, on their tablet, and having those accessible to them. So again, to come back to communication challenges, the joint attention can be a challenge, social communication can be a challenge, executive function related language issues can be a challenge. They may not know the sequence of things, or they're not able to see the perspective of the other person and react accordingly. So those type of higher level task challenges or higher level communication challenges are also seen very commonly.
Thank you so much, Amrita. This is amazing the way you talk more about the challenges, specifically, with when it comes to the communication as well. My next question is a common question to all the panelists. Sleep disturbances are common in autism. What strategies from neurology, Ayurveda, nutrition, and speech therapy can improve sleep quality? Who would like to go first?
For sleep disturbance, Shirodhara procedure is most important. Another is the Shirobasti, Shiropichu, and novel formulation is available in market. That is the Siddhartha Gruta, Mahakalyana Gruta, Brahmi Gruta, Panchagavya Gruta, Panchabhautik Tailam, Abhyangam. Vasification therapy is the most important for sleep disturbance. And dietary management is also important. That is, heavy food is especially avoid. Then another is the yoga, pranayam. This is also important for sleep disturbance.
Thank you so much. Who would like to go next, talking about and shedding the light on insights?
Yes, I think I'll go next. So regarding the sleep, it can be sometimes as simple as just adding a supplement. I mean, sometimes they could be deficient in magnesium, or they could be deficient in B6, which will make the GABA, which will help them to unwind. It could be as simple as that, but it could be as complicated as opening the detoxification pathways, and especially clearing the constipation. That's the prime importance, I feel, to I see like the sleep and the constipation, a lot of times it goes together in my experience. So if they have any sleep issues, the first thing that I would do is to clear the constipation. And for that, there could be multiple reasons. Like I said, it could be as simple as a nutrition deficiency to the food sensitivity that's kind of causing an inflammation in the gut. So it could be too many things that's going on, right? So it's like, so gut health is the main thing for me to improve the sleep. And also it's the vagal toning that has to happen, means like the gut and the brain connection is usually comes with the vagus nerve. Right. So like when the Dinacharya was mentioned, I was even thinking about how in olden times we were taught to really do the Surya Namaskaram, in the morning to get the infrared light. Right. So it was like, but nowadays I feel the more we go away from the nature, the more problems we're facing. Because I tell parents a lot of times, like people go to the infrared sauna, the infrared therapy, just with a small light for the knee pain and everything. But then, like, this is the nature's given gift, which is the infrared therapy in the morning sunlight when it's orange, right? It kind of opens the detoxification pathways, right? And then that beautifully also activates the melatonin that can be secreted during the day. Right. So it's like, I mean, of course, there are some melatonin that's made during the night that's important for sleep, but I feel like the antioxidant capacity of the body has to be overall improved to even hone into the sleep quality. I mean, because a lot of times they sleep for a long time, but the quality of the sleep is not reported well as such. So I feel it's not just the diet, it's like everything together, in my opinion.
Thank you so much, Devi. Dr. Gola, you had something to share.
Yes. I think Sridevi beautifully explained the circadian rhythm and how important the sleep clock regulation is. And this is irregular or the irregular circadian rhythms, what we see commonly with children with autism. So some of the common sleep challenges with autism are difficulty falling asleep because of prolonged sleep onset latency, frequent night awakenings, short sleep duration, early morning waking, sensory sensitivities, and the irregular circadian rhythms. And melatonin is not produced the way it's produced in normal people. Like sometimes we see in shift workers and people who work in the nights as well, that melatonin is not produced as it should. And this is something which affects children with autism as well. And there is melatonin, something natural like melatonin, which is over the counter, can help. But in addition, I would also like to emphasize some of the behavioral sleep therapies. ABA can help. ABA techniques like bedtime fading or graduated extinction. Positive reinforcement is very important for children to stay in bed. Parent coaching is important as well. Some of the sleep hygiene strategies, though it sounds boring and prolonged, I think if parents can incorporate that and if the child can incorporate that, fixed bedtime, wake up timings, calming pre-time routines, sensory-friendly sleep environments are very important for children with autism, like blackout curtains, white noise can sometimes help, weighted blankets can help children with autism help with some of the sleep-related sensory issues. Last but not the least, limited screen time is very important, and nowadays every child has a phone or there's a TV in the bedroom where the child is sleeping. So I think those should be taken out, or I say you have to park it like you park a car away in a different room. In terms of pharmacological interventions, from a neurologic perspective, I think melatonin can sometimes help 30 minutes before bedtime. It's safe for short-term use, but again, it's as needed. And if nothing helps, then the last resort is something like clonidine, but again, it all comes with side effects. So I would avoid sleep medications as much as possible and use it as a last resort. Again, lastly, I would like to emphasize the fact like it's not just the neurologist or the pediatrician, it's the collaboration and multidisciplinary support with the occupational therapists, nutritionists, behavioral therapists, sleep specialist, which plays quite a vital role in the sleep hygiene for these children.
Thank you
Thank
so
you.
much, Dr. Gola. Amazing answer. I think you've shared some wonderful insights. Dr. Carla?
Yes, being a psychiatrist, I would like to mention here that this is very important to understand. Avoiding, we call it as nidana parivarjana. So nidanas means causative factor. So one of the biggest causative factor is screen times, as Dr. Gola mentioned about that, and external stimuli. External stimuli may be anything, right? These kids are very sensitive to any of the stimuli, like light, even a small light, right? That can make them active. Even kids, they roam in the nights. Means roaming means they have disruptive life cycle, right? Circadian rhythm. So they love to roam around at nights, and they have to be sleep hygiene, as she mentioned about, means it has to be maintained. And second, I would like to tell about the use of certain oils. Abhyanga, pad abhyanga means foot massage. This is very important to understand. Dr. Vinayak also, Vaidya Vinayak ji also mentioned about putting oil over the head, shiropichu. It's very important as well. Means it depends upon the kid's condition and sensorial issues as well, whether they would like or not. Because it's very, we should understand their needs and wants as well. If they don't like it, we shouldn't go forcefully. We shouldn't force them to put oil or anything on their feet, but that's very calming. At the same time, it calms down the hyperactivity vata. So what we were talking about. And second thing, it adjusts with, we talk about certain we have certain areas at palms and feet where we can rub gently and give pressure points on those things, marmas actually. So that is directly that will directly stimulate the function of, or production of melatonin at night. So I believe that these all things, and Shirodhara, if the kid is big enough, they are in that age where we could introduce all these uh, panchkarma treatments once or twice in a year, and as well seasonal detoxification therapies. That would be one of the best things to go for. Thank you.
Thank you so much, Dr. Karla. Amrita, would you like to shed some insights?
Yeah, from a speech therapist perspective, and having worked with occupational therapists, with co-treating with some occupational therapists, I would like to add a couple of things. Sometimes, we went back to that vocabulary piece, or that the transition piece. So these children, when routines are predictable for our children with autism, it's they can accept it a little better. So when there is a visual support that we eat like a established bedtime routine, which screens are away, of course, sleep hygiene, but also a routine and structure where dinner happens, maybe a story happens, maybe a short play time happens, uh, maybe a bath time happens, along with the foot and hair and the oil massage, and then maybe they go to bed. So when it's predictable and structured like that, there is better acceptance. And this is a very evidence-based strategy, having that visual support and a structure, and also letting them know that sleep time or bedtime is coming after 1, 2, and 3, giving them that language and helping them understand what that means. When bedtime happens, that means lights will be turned off, and the expectation is that you are in bed and sleeping. Um, Having that language available to them. And also, I would like to point out, all of us human beings have different sensory profiles. We all know about our 5 senses, but actually now, also what is well known is there are actually beyond those 5 senses. We have 8 known senses, and probably so many more that will light will get shed on later. We have our vision, hearing, tactile, taste, smell, but we also have the proprioceptive sense, we have the vestibular sense, and we have the interoceptive sense. And some of us are sensory seeking, some of us could be sensory avoiding. And then knowing that each individual child may have a unique profile where they might be sensory seeking in one area, sensory avoiding in another area. A child may need that deep pressure, and a weighted blanket would do wonders for them, but another child might need to do bear walks to get that additional proprioceptive input right before bed so that their body can actually calm down and go to bed. So working in collaboration with for some children, that calming routine helps. For some children, what may seem as an activating routine, but actually those senses are getting activated for their body to then calm down. So working in collaboration with an OT to understand your child's sensory profile, and using the visual structure and the language piece there, and then working in collaboration with all the other therapies that are happening to help build a good sleep routine.
Thank you so much, Amrita. I mean, it is wonderful, like all the panelists are providing their expertise, their perspectives, on as we talk more about autism. We're almost getting towards the end of our session. So this is the last question for all of us that will tie up this session for all of us, is what does the future of integrative autism care look like? How can different healthcare professionals work together in an integrative approach? Anybody can go first.
Okay, so this is Shridevi. So like what I'm thinking the future should be like first off prevention, first thing that I point out. Like Dr. Sanjeev first pointed out, how it's important to do a prenatal counseling. So like we have seen how the gut microbiome transfers from the mother to the gut in the early pregnancies, and then like that decides the epigenetics of the kid later. So it's like I feel like the prenatal counseling has to be given more importance. And so in this integrative model, I generally don't see a gynecologist in the integrative model. So it'll be helpful for future to even put them as an integrative care model, because like it is really a chain. Because like if they and I feel like a lot of ladies go to get educated from the gynecologist about the fertility care, about the pregnancy care and all that. So like I feel it'll be very helpful to give them the awareness that they have to be part of this integrative team too. So just preventing I feel like just taking care of the health of the baby right from the beginning. And if at all, if the mom knows that she has an MTHFR issue going on, then it's really helpful to take care of her right from the beginning and let the gynecologist know about it so she can integrate with avoiding too much of autism diagnosis going on. I mean, I want rather than too much of autism features getting expressed, I would say that.
Thank you so much, Devi. Who would like to go next? Dr. Carla?
So here I would like to mention two more things. As Shridevi mentioned about the inclusion of gynecologists, I would like to mention here a very simple thing. As we are seeing the changing world, there are complexities as well coming up along, right? Because of the introduction of, as we have seen, the technology is changing every day. It's dynamic. And because of that, couples are getting more and more busier in their lives, right? So the age for their pregnancies is getting even going far away. Means paternal age and maternal age, that is actually one of the biggest reasons for causing these kind of neurodevelopmental or neurodivergent conditions in kids actually. And second thing I would like to mention here, that when we talk about integration means this is not something from the very perspective I say that, oh, being a psychiatrist, I'm the only person who is going to take care of the kids who are suffering from ADHD or autism or any other condition. But here, this is a complete team effort. This is not something that I'm the boss or we are as a team can work from pediatrician to a gynecologist to a psychiatrist to a neurologist. And dietitian's role is very important here because they try to mention, and at the same time, when we talk about diagnosis means it's from not perspective from the perspective of a neurologist or a psychiatrist, that introducing some we put some scales, like cars, for example, and other scales. But Ayurveda says that as genetic testing or everything is coming up so widely, it is exome that mapping and anything it can be. It was already in Ayurveda when we talk about Prakriti analysis, right? Prakriti analysis and imbalances at the same time, that maps everything. Then we come up with all those 8 faculties where we look for, that is in Ayurveda, it is very detailed, mental status examination, we call it as in Ayurveda. According to Ayurveda, we can have so much of, at the same time, importance of speech therapist, occupational therapist. That is very important as well, when to introduce those services along with ABA, applied behavior analysis, which is very important. Again, tailor-made. This is something that for each kid, it is necessary, an inclusive approach, not to exclude any of these things, areas, very important areas they are. You're muted, Dr. Gauri.
Dr. Gola? Thank you so much,
Yes.
Dr. Gola,
Thank
please.
you. Yeah, Dr. Kalra beautifully emphasized the involvement of a multidisciplinary team and personalized approach. I think the future of integrative autism care, it's evolving rapidly, but it has to be personalized because every child with autism is different from another child with autism. So it has to be family centered, but also involvement of multidisciplinary teams like speech, occupational psychology, pediatricians, psychiatry, educators, dietitians. It's very important to have a collaborative model because that also involves like family involvement, recognizing that caregivers are essential partners and not just the physician. So we need to make the parents as essential partners because they are involved in the day-to-day routine of their child. In that way, the technology platforms now, which is advancing with AI, that helps with real-time communication. It also helps some of the apps help with behavioral tracking and shared care plans, schedules, and advanced techniques like that. Again, a whole body approach involving nutritional, gut-brain axis, environment, stress management is very much important with added technology to enhance the personalization for each child. So I would say sensory-friendly environments, meeting families, like organizing these autism walks, autism speaks, and certain other things which empower is very important in today's world. In addition to the newly emerging therapies and treatments, is what I would say. The word take-home message is collaboration.
Thank you so much, Dr. Gola. Amrita?
I agree with everyone, like such great points, multidisciplinary collaboration, family-centered. I would even go beyond that and say individual-centered, because, we have, throughout the years now, we have great therapies, technologies, treatments that we have seen benefit children as they grow into young adults and beyond. And now we are able to hear the voices of autistic people themselves, children who have received all these treatments individuals who have received these treatments as they were growing and are now even in the workforce. And something that is coming out is they were not always included in the decision making. So I would say an integrative approach is definitely taking the individual, whether it's a 2-year-old, a 12-year-old, or a 22 or a 52-year-old, asking them what they want, and making goals, keeping them in perspective, keeping them in the center, and they are never forgetting that they are the center of all of this. Because we're also now hearing from autistic adults about masking and how they learned behaviors that they had to avoid in order to function, and helping them not to mask, being comfortable expressing who they are as a person, and making them feel that they are included in the general, we are creating that inclusive environment for them, keeping them at the heart and center.
Thank you so much, Amrita. Dr. Taide? Dr. Taide? So we are almost towards the end of our session.
Yeah.
Dr. Taide, yeah, please go
Yeah.
ahead.
Integrated autism care. In these questions, we can improve the quality of life with the Ayurvedic management and therapy. The first thing. Second thing, early detection of autism and early treatment better for life, and rule out the causative factors of autism, child care, and counseling parents, and early detection of ex-fagrile factors to rule out autism, and avoid the environmental factors, stress, cold exposure, etc. Thank you.
Thank you so much, Dr. Taide. We are almost toward the end of our session, and a lot of our audience have asked specific questions, specifically for autism. I would definitely request all this audience that if you have specific questions related to the autism care, please reach out to our experts. But I will definitely take one question over here. when it comes to, and this is, and anybody can answer this question, does reflex integration help with cognition, hyperactivity, or sensory issues? Let me repeat the question. Again, anybody in our experts panelists can answer the question. Does reflex integration help with cognition, hyperactivity, or sensory issues?
If Dr. Gola wants to answer, that's great.
Yeah.
But I would say like ROTs tend to be the experts in this area. And yes, again, it is very individualized. Reflex integration, if needed, and if assessed completely, and it is found that the child is not able to, is lacking function because of lack of reflex integration, then yes, definitely we see that working on reflex integration can help with those challenges. Dr. Gola, your insight?
Thank you, Amrita. I think I completely agree with you. We always refer to our occupational therapists as well to help with some of these. I think it's sensory linked as well. So I would say some of the reflexes, like which remain in utero, like the Moro reflex, or other primitive reflexes are sometimes a little not so well developed in children with autism. And that results in some of the deficiencies in cognition, learning, hyperactivity, attention. So with the help of physical and occupational therapists, some of those reflex integration exercises, which Amrita just discussed, can help calm the brainstem and help self-regulation. So to answer the audience question, I think yes, there is a huge role, and I think consulting with a specialist occupational therapist or asking a physician to help with those, because they are sensory linked, and promoting those exercises or integration or helping with the sensory overload will help with some of the abnormalities associated with these reflex disintegration or sensory disintegration is what I would say.
Excellent. So we're almost towards the end of our session. I know we have a lot of questions from the audience and specific questions for different, treatments and things. And again, I would request all the audience, if you have specific questions, please reach out to our experts. We are almost towards the end, and I would again request our ARC president, Dr. Amit Guman, to give the vote of thanks.
Thank you so much. It was such an amazing session. I think this would be like a very good manual or like a very good resource for people who are going through autism in their family or people who are providers in healthcare. And thank you, Dr. Gauri Vijayanagar, for a great job in moderating the session. I think you did such a great thing. We get up. I think we do make a great team with Deepa's prayer and Dr. Meenakshi and everyone. Thank you to the team and also to the wonderful panel. I think we covered almost all the aspects, broad spectrum, wide spectrum, all the different dimensions, multidimensional aspects of autism care. And I do like to emphasize here is like, in care of autism, we have to remember that we have to think outside the box and also realize that there is no box. So that's very important. And thank you to Dr. Kalra for covering all the aspects of the Ayurvedic aspect of Unmada, Manava Srotas, Sanjava Srotas, Dan Parivartan. I think you did a great job in talking about the mental state exam and all the different aspects of traditional Ayurveda. And thanks to Dr. Tarde for talking about the Agni, about the Ritacharya, spatial language, Bhuti, Vata, Kapha, Unmad. You covered very well about the Ayurvedic modalities. And Dr. Sailaja Gola, you did a great job for bringing the modern perspective and at the same time all-inclusive, collaborative aspects of managing. And I'm glad you touched briefly on cannabis too, which is playing a very important role now I see a lot of my clients who are patients, they're using cannabis with very good success, and that's one of the reasons I think we're going to be starting, using Ayurvedic Vijaya-based preparations too. I think that's going to help a lot. Amrita ji, you did awesome job in talking about. I liked your what you said. It's time lost is time gone, and you covered very excellently. About inclusive and accepting the patients. Accepting and I'm glad you brought about the eight senses. Beyond the five senses. I think you did a great job of uh, talking about the comprehensive, collaborative. And you did a great job of also about how the clients can be sensory avoiding or sensory seeking. And Sridevi ji, you did awesome too about the vagus nerve. We talked about the inclusion of gut microbiome. Thank you so much, Sridevi. I think the panel, everyone did such a wonderful job. Sridevi and Shailaja, Amruta, everyone did a great job. Thank you so much for being a part of this session, which is so informative, and I'm sure it would go a long way in helping many people. Thank you, everyone.
Thank you so much, Amit. And again, thank you to all our esteemed panelists for providing their time, providing their expertise today. And again, to all the audience over here, please remember that we do bring in these webinars every month. So please join in for this webinars. And again, a disclaimer to everybody on audience, just to make sure that all the information is only for information purposes. And again, there's no medical advice provided. If you have any specific questions, please make sure that you talk to your healthcare professional. You can also reach out to our panelists over here for any specific questions. Again, thank you all of you.